Hello, this is Marame Carpo, and I welcome you all to your first safety adventure. Today, you will learn about the basics of first aid, its meaning, and its importance. And at the end of the discussion, you will be able to discuss the characteristics of a good first aider, the rules, the objectives, and the principles of first aid. What will you do if you will see an accident and there's an injured person with it? Are you just going to look at it? Are you going to call an ambulance to call for a help? And what if medical assistance is not available or delayed? Of course, you will give first aid to an injured person or to the victim. Now, let's define first aid. First aid is an immediate and temporary care given to a person who gets ill and injured. It includes self-help and home care if medical assistance is not available or delayed. First aid means difference from life and death in extreme cases. Now, why do we must know the limits in giving a first aid, or why do we put limits in giving a first aid? It is because an appropriate first aid can do more harm than good in some instances. Now, we have first the roles of first aid. Number one role. First aid is a bridge that fills the gap between the victim and the physician. It is because first aid can create a relationship between the physician and the victim, and the physician also help the victim to get better. Second role. It is not intended to compete with or to take the place of the services of the physician, because as what the definition itself, first aid is just a temporary care given to a victim, and physician knows better and he knows better and she has a lot of knowledge on how the victim to get better. Next, it ends when the services of the physician begins. When the victim taken already to the hospital, that is the time the job of the physician begins. Now, we have the objectives of first aid. Number one, first aid save life. Like for example, you call for an outing with your friends, and one of your friend drawn, and he or she is unconscious. And what will you do? You will give first aid so that you can save his life. Next, first aid can prolong life. Prolong or extend. By the help of the first aid, you can extend the life of the victim. Third, to alleviate suffering. To alleviate means to reduce the pain, is to reduce the pain of the victim from suffering. Next is prevent further injury. First aid can prevent further injury, and it is also help so that the injury can't get worsened. Now we have the characteristics of a good first aider. First, gentle. You have to be gentle, or you have to be careful. You have to be careful in giving a first aid to the victim so that his or her injury cannot be worsened. Second, observant. You have to observe all the signs of the victim or to an injured person. You have to check his pulses, the circulation, his breathing, the airways. You have to check if there are wounds, if there are injuries, or if they are bleeding, hemorrhage, all and all. Next, resourceful. Resourceful means makes the best use of things at hand. You have to be very creative and you have to be very resourceful in giving a first aid, especially if medical assistance is not available. Fourth, tactful. The, you have to be careful in your words can't so that the victim can't panic can't panic and yes, can't panic. And lastly is sympathetic. You have to reassure the victim and you have to comfort the victim so that his or his injury will not get worsened. Now, we have the principles of first aid. We have first the those in giving first aid. Number one, do stay calm. Stay calm so that your patient will not freak out. Number two, do reassure and comfort, making your victim is safe and she is comfortable in her environment. Third, do check for medical bracelet indicating a condition such as epilepsy or diabetes. Check the victim's medical background to know if he or she has diabetes or epilepsy so that you'll know what to give him, her, or not. Fourth, do loosen any tight clothing. Make sure your victim can breathe properly. Check his or her clothing if it is right so that you can loosen it, like the belt in the victim's pants. Fifth, do keep the victim covered to reduce shock. Make sure that victim can recover from shock. Don't let the victim see the aftermath of the incident. Now let's go to the don'ts in giving first aid. Number one, don't give food and drink to an unconscious person. Let the victim rest and breathe fresh air. Number two, don't move an injured person unless you need him or her in the recovery position. Don't move an injured victim to avoid him or her from serious injuries. If ever, ask for assistance to help you so that the victim's injured body part will not get worse. So that's all for today's discussion and thank you for listening and watching. Bye!